The following program has been furnished and paid for by Ask the Expert Show. KSEV is not responsible for its content or the products or services offered. Welcome to the Ask the Expert Show with local experts in the field of health, legal, financial, and home improvement. Now, here's your host.
And we do welcome you to another edition of Ask the Experts here on AM 700 KSEV, the voice of Texas. I'm Jack Gonzalez. And as you heard in our opening, we talk about various fields of business that might be of particular interest to you. And in this segment of Ask the Experts, we're going to talk about something that may be very important to you, or maybe someone you know, a loved one, a grandparent, or a parent who is looking for some home health and hospice care. And just a man to talk to us about that is Felix Canabal with Avatar Home Health and Hospice Care. Thank you for joining us for another segment of Ask the Experts, Felix.
Oh, it's always a pleasure to join you on Sundays.
Yes, it is, and with beautiful weather we've got too. So let's jump into talking a little bit about yourself and your business before we get into the work that you provide for our listeners. You've been around for quite a while.
Yeah, we started the agency back in 2006. The accreditation, or in other words, they came and did the inspection in 2007. And ever since then, we've been taking care of people in Harris and Montgomery County and a little bit further too. You know, we take care right now of I talk about it, Jack, and it seems unbelievable that a few years ago we started with 0 patients, and right now 400 patients in our census.
And that is quite a bit. In that time, you've gone through a few inspections, and we want to point that out because of the fact that obviously we've heard some bad news about home health and hospice care in the news, but of course it's just the opposite for you, and you've got quite a few compliments, not just from your patients, but you've gotten awards for your work as well, too.
Exactly. Yes, Avatar Home Health and Hospice is a recipient of the Gold Seal of Approval from the Joint Commission, which is basically, not to get technical, because if you're not in the health business, it's difficult to understand, but basically it's the highest accreditation that you can get as a home health or hospice agency. And just to show you, Jack, the state of Texas is the one with the biggest number of home health and hospice agencies in the whole United States. And out of all these agencies in Texas, only 9% have been awarded with the Gold Seal of Approval from the Joint Commission. And Avatar Home Health and Hospice happens to be in that very select group. So I'm very proud of having accomplished that, not only back in 2007, but we've been getting it consistently through whatever amount of years we've been in business now, 12, 13 years already, and we have never failed once to receive the Gold Seal of Approval. That speaks to the quality of nurses that we have, the home health aides, the therapists. I mean, the whole team of Avatar Home Health and Hospice, I am so lucky to be able to be surrounded by this type of professionals and the care that they show. I mean, I do care too, but I don't want to be included because I think they're way above me. The way they treat the patients, the way they care for the patients, they on their own, Jack, they enroll in all these different classes to become better nurses and better aides and better therapists. And we don't tell them to do it. They just want to be better.
And that's great that they take it upon themselves to want to be better, Felix. That shows a lot of initiative. And we want to also stress it's not just their education on what to do, but they're very caring, because we've read in the past testimonials. In fact, we've had some of your clients with us who have spoken very highly of the care that they've received. In fact, when the care has had to stop, they say, oh, no, we want to continue because they love the care that they got one-on-one from your associates.
Home health. The patients stay with us for 2 months, 3, 4, 5 months, and we see them 2 or 3 times a week, depending on their needs. But there will come a point in time, in 99% of the cases, where we have to discharge the patient because they are stable. There's nothing else that we can do for them to improve their condition. So when that point comes, man, that's a hard one, because they call me and they say, well, you know, I want my nurse because she's very good to me, and they, you know, they get upset at me because I have to give them the bad news.
Yeah, they think you're being a bad guy, but you're not.
Right, but because I have to remind them that we have to obey by Medicare regulations, and we have to obey by the doctor's orders. So if a doctor tells us, you know, discharge the patient, you know, she's already got the maximum that she was going to get or he was going to get from home health, we have to do that, and basically that's our job. Our job is to get the patient better, get him stronger, and then we discharge him.
And you also get inspected on the spot. They'll just show up at your door and say, we want to look at this and look at that. And, of course, you've passed those inspections in the past, and that's pretty good considering you're not giving any pre-warning. When I was in the military, they would always tell us, hey, we're going to have an inspection, and so we'd have to prepare in advance, get this squared away, using my military terms now, squared away and that squared away. And you don't have that opportunity. They just show up at your door and asking for stuff.
We have to be ready at all times. This is like at the beginning it's kind of stressful because you say, oh my God, they're going to come. And now you kind of welcome them and say, yeah, let them come, because we're confident that we're doing things, up to all the regulations that we have to comply with. And we wouldn't do it otherwise, even if there was no inspections. If you're a professional and you care about your patients, and you could care about your license, because we're licensed, by the state of Texas. We are accredited by the Joint Commission. We're certified by Medicare and Medicaid. And those are certifications and accreditations and the licensing. Not only do they cost a lot of money, but it's a lot of effort that we have put into that. And we're not gonna risk it by taking shortcuts and not doing what the patients need us to do.
And we just received word recently that President Trump had passed the Medicare CARES Act. Felix, talk about a little bit how that would affect your work at Avatar Home Health and Hospice Care.
Yeah, actually, that I wasn't even thinking about that. And the other day, I got a notification from the Center for Medicare Services, and I read it, and it brought up to light that the Trump administration has passed this Medicare CARES Act, where they're helping all the Medicare providers. That includes the hospitals, doctors, home health agencies, hospice agencies. So anyone who gets paid by Medicare has the opportunity to ask for an advance, because these are very hard times for all of us. And I'll expand into that a little bit afterwards. But basically what the act does is says, okay, we're going to give you an advance, and then you don't have to pay anything for 4 months, because hopefully 4 months from now, things will be, if not back to normal 100%, but almost back to normal. So we don't have to start paying that money back until 4 months from now. And then they're giving us a whole year to pay it back, and they're not charging us interest. So for a small businessman, even for a big hospital, it's the same. Because of the virus, we are running out of cash, because we're not making the same kind of money that we used to make. And yet, in our case, and I can only speak for my agency, but do you believe, Jack, that under the conditions that we're working now with the coronavirus, not one single employee of mine, and we employ 205 people now, not one have called the office and said, look, I'm afraid to see the patient. I want to stay home because of my family, blah, blah, blah. And if they were to tell us and call us and tell us that, we will understand it and we will accept it, and there will be no retaliation or nothing, because I understand, because the same thing goes for me. I want to be safe. My daughter is a nurse, so she also exposed to that. So, but not a single one have asked us for days off because of the virus.
And that is great, Felix, because your patients need that care, and it would be harmful, obviously, if they didn't have that care. So it's great that you're not having to scramble around and find a nurse to look after them because of that. So that just once again shows the dedication by your employees to do the job, and how much they, of course, care for their patients as well, too, because I'm sure they keep that in mind as well. So that's a great.
Yeah, that's when you watch the news and you see the policemen and so on, blowing their sirens and blowing their horns when the doctors and the nurses come out of the hospitals. Hey, listen, that's what I told my nurses and my aides and everybody that works at Avatar. No one in the office has been absent. I mean, this is something. I talk about it, I get goosebumps, because I I expect us, oh my God, now half the people are going to ask for days off or whatever. It hasn't happened, not even one. So we're able to take care of the patients. Now, on the other hand, many patients are afraid that the nurses and the aides and what have you will bring their virus up to inside their home. And they have asked us to stop visiting them, which is, in my opinion, is a big mistake. Because as a matter of fact, a few of them, because they have stopped getting the services from us because they asked us for it, they ended up in the hospital. And then they end up in the hospital is not going to take them. They send them home and say, no, deal with it the best you can. Call your doctor. And that's why the doctor ordered them into home health to begin with. And unfortunately, we have one sad case that the patient told us to stop the services. And then 2 weeks later, he calls and he says, I want my services. So we said, fine, we'll send you the nurse tomorrow. And the nurse showed up the next day, and he had just died. So, that's a sad story.
And that's why, yes, I was just going to throw in, that's why it's important that they keep the health care, because that the nurses that come out there not only care for them at that moment, but they also are watching the patient to make sure they're okay. They're monitoring their situation, and if they see something that needs to be done, they can take care of it. In fact, you work with the doctors as well, the patient's doctors, and you can let them know, hey, this patient, we saw this patient, we didn't see that. So that's very important. Felix, we're going to take a quick moment to step away for a quick break. And by the way, as we are leaving, let's pass along Felix's own cell number. He'll pick up that phone himself. That's 281-703-8050. Felix Cannibal with Avatar Home Health. If you're interested in his services, and we certainly hope you are, then please do give him a call. But we're going to step away. I'm Jack Gonzalez, and that is Felix Cannibal, and you are listening to Ask the Experts here on AM 700 KSEV, the voice of Texas. We'll be right back.
Do you or anyone you know need help with your daily activities, grocery shopping, bathing, cleaning, cooking? If you do, Avatar Home Health and Hospice can help you. Avatar Home Health can also help if you need nursing services and or therapy services in the convenience of your home. If you live in Harris or Montgomery County, in most cases, they can start services within 24 hours of your calling them. Avatar Home Health and Hospice was established in 2006. Avatar Home Health and Hospice is not only Medicare and Medicaid certified and licensed and insured, but is one of the few agencies that has received the Gold Seal from the Joint Commission. This accreditation has only been granted to less than 9% of the agencies in Texas. At this time, Avatar Home Health and Hospice takes care of over 340 patients. Whether it's home health, hospice, or caretaker services, one of their 220 professionals will be assigned to help you. Avatar Home Health accepts Medicare, Medicaid, United Healthcare, Aetna, Molina, Humana PPO, and other insurance companies. They also accept private pay patients. They can also help you find what benefits you qualify for. Most of their services are paid by Medicare, Medicaid, or your insurance company most of the time, without any out-of-pocket expense to you. Call Avatar Home Health and Hospice at 281-703-8050. That's 281-703-8050. Or email them at info@avatarhomehealth.com.
And welcome back to Ask the Expert here on AM 700 KSEV, the voice of Texas. I'm Jack Gonzalez, and if you're just tuning in, we're talking about home health and hospice care, Avatar Home Health and Hospice Care. And Felix, we gave a little background about you, yourself, and your company, so let's get a little bit more detail as far as the services that you do provide.
Actually, Avatar Home Health and Hospice is one of the very few agencies provide home health, hospice, and provider or caretaker services. So this is like having three agencies in one. We have the home health side where we take care of patients by sending them nurses and physical, occupational, or speech therapists and home health aides, also social workers in case they need additional help. That is a service that is going to be intermittent. In other words, we start the services today, and 2-3 months from now, or maybe a week from now, it all depends. Usually it's like 2 to 4 months. The patient becomes stable. The patient has received enough therapy where they got more strength to do their daily activities. At that point, if nothing has happened, in other words, they haven't fallen down or they haven't gone back into the hospital, if they're stable, they've gotten better, we discharge them, because that is the purpose of home health. It's a temporary care of the patient until they get stable. Then we go into hospice. Hospice is for those patients that have a terminal illness that the doctor has determined that there's nothing else they can do, and the illness takes its normal course. That patient is going to die within 6 months. I mean, that's a rule of thumb. Obviously, the patients sometimes live much longer than that. For those patients, we also have the nurses, the therapists, and the home health aide, but we also provide them with a counselor that will counsel the patient and the family how to handle these very difficult times, because basically we're getting the family and the patient to say goodbye, getting them ready for this very important part of everybody's life. Enjoy my life for X amount of years, and now I have to say goodbye to my loved ones and goodbye to everything that I've done all my life. So this takes a special person or persons to help the families and the patient to be able to deal with all of that. Then we also have the spiritual side to it, where we add the chaplain. In most cases, the people want the chaplain to come by, read the scriptures with them, pray with them, pray with the family, for the family, bring them communion. And then, of course, that's up to the patient. If the patient says, no, I don't want that, then we don't do it. Again, all our services are like going into a fancy restaurant and you can order whatever you want, but you don't have to order anything if you don't want to.
And that spiritual care is just so important at a time like that, Felix. And it's
Yes.
great because I've never heard of a home health or hospice care that helps provide that. But when you're facing that type of situation in your life, not just for the patient themselves, but family members who see them suffering like that, it's very important to receive that spiritual uplifting. So it's great that you guys provide that type of service for them as well, too.
Yes, we do that in hospice. Actually, Jack, that's mandated by Medicare. So other agencies do it, too. Many times the patient says, well, I don't know. And I always encourage them. I said, look, at least let the chaplain and the social worker come and meet with you at least one time. That way you know them, you've met them personally, and then if you don't want to use them, you don't have to use them. When you need them, you already know that person. The ice isn't broken, per se. You know, I mean, you already know the person, you're familiar with that person, and it becomes easier to open up to that person.
And sometimes you may not know how much you really need that, because I know I'll be honest, just like everybody else, we get down a little bit sometimes, but when I go to church on Sundays, and I'm not just saying this for the benefit of the program, I come out, I feel a little bit better. So that spiritual care can really help someone as far as be a little bit uplifting to know that there's a good Lord up there looking out for them. That's a nice reminder of that.
And locally, the chaplain that we have, she's just a sweetheart. She takes care of so many people. I mean, she's truly an angel, and I've used that word before in many of my shows because that's the most common description for the people that work for our agency, where patients call me and said, you know, Mr. Felix, all I wanted you to know is that so-and-so is not a nurse, she's an angel, and Adalia, our chaplain, consider her to be an angel. She has her own non-for-profit organization where she feeds the hungry. This lady works from 6 o'clock in the morning. I don't even know if she sleeps. She was in my office Friday afternoon, and she was getting ready to deliver food to the hungry. And I go, when do you rest? And she said, oh, that's okay. I don't need to rest. As long as I'm taking care of other people.
Isn't that great?
You know, the Lord takes care of me. And
Sure.
She's always so full of energy and always smiling. And I go, well, how does she do it? Jesus. That's the kind of people that
Right.
we have working here.
Right.
Jack.
And you said angels, and, you know, in the testimonies that I've mentioned before that we've read, that's just what your patients have said about the
Yes.
workers that come out looking after them. They've called them angels. And let's talk a little bit about, of course, that what we just talked about is important as well, too, but there are some in-home services that your providers give their
Correct.
patients as well, too. So let's
Correct.
touch a little bit on that.
I'm glad you brought it up, Jack, because that's the third leg of our agency. That's the provider department. Now, under Medicaid, patients can get a provider, somebody that goes to their homes, spends 2, 3, 4 hours a day, depends on their need. That's all approved by Medicaid or by the insurance company. And this person goes to the patient's home and cleans up a little bit, light cleaning, light cooking. They go to the store for the patient. They might go to the pharmacy. They might escort the patient to the doctor. They help the patient with everyday activities that the patient cannot do by themselves. And that is also not only provided by Medicaid, but that is also provided by long-term policies. So If you're listening and you have a long-term policy, you're doubtful as what the services that you're entitled to, call me at 281-703-8050. That's 281-703-8050, and I'll review your benefits, and I can tell you, okay, these are the benefits that you can expect when you need them. So even if you don't need your services now, give me a call. That way we talk. I get to know you. You get to know me. And I can help you in the future. When you need anything, you say, hey, I know that number to call. You call 281-703-8050, and within 24 hours, we're going to be helping you. I mean, that's how fast we act.
And how early do you recommend that, far in advance, do you think somebody should look into that type of service for, if not themselves, for their loved one?
That is so important, Jack. If you listen to the show today, call me today or call me tomorrow. And the sooner you know what you need to do in case of that emergency, you don't have to be stressing out and calling 20 agencies to see who can help you. You don't have to do anything like that. You call me and I'll set you straight. As a matter of fact, Jack, I think it was like last Thursday, I had a phone call from this lady and says, oh, I want you to take care of my husband. I know that you guys are the best. And I don't know where she heard that from, but thank you. And so she said, oh, you're the best. I heard very good things about your agency. And she went on and on and on. And she was very happy and relieved, thinking that we were going to take care of her husband. So then I said, okay, so what is your insurance? So I take the information. And then she has an insurance policy. We're not in network with our company. So I had to give her the bad news that we cannot help her. She has to go to an agency that has a contract with that particular insurance. So then she was, oh, no, I wanted you guys. And I said, okay. But she says, I just signed up with them. I said, ma'am, if you would have called me back in December, I would have told you don't sign up with that company if you want to have services from my agency. You see? So it's something that as mundane as that, as the insurance company, that is very important because if we're not part of that network, we cannot help you.
So tell the listeners then, so that way they'll know in advance, what are the insurance agencies that you do work with or can you mention that? It's a long list.
It's a long list.
But you can provide that information for them if they call you, correct?
Yeah, if they call me, right. But the best thing to do is this, and this is the reason why they call me. Like this lady, she called me, and she said to me, so what do I have to do to change insurances? Because I want to go to the insurance companies that work with you. I said, well, now you got to wait until the end of the year. If you don't change insurances during that elective period, which starts in October and ends in December or something like that, you're stuck with that policy for the rest of the year. And that's another thing. You might have questions about the insurance. Call me at 281-703-8050. I'll clear things up for you. And if I don't have the answer, I'll get the answer for you. I've been doing this for 14 years, Jack. Back when I was a young man, I sold life and health insurance.
You're still a young man, Felix. What are you talking about, huh?
Yeah, I'm a young 72.
That's right.
But that's okay. I'm very glad that I'm healthy and I can do what I do for the patients and for my family.
Felix, we only have a few minutes here. So we mentioned the nurses earlier. So if we have some nurses out there who are looking for work, you're always hiring. So how would they go about looking at possibly being employed by Avatar?
Right, yes. I mean, we give you a real nice package. Home health is different than working in a hospital. So nurses want to work a lot. Some nurses want to work just a few visits. So we work something out to keep you happy. You'll be glad to be working for us. Now, Jack, I'm desperate to get a good RN in the area of I-69 to cover the area from around Kingwood all the way to Cleveland. I also would need a registered nurse for the southeast part of the city, the Galena Park, Pasadena, Pearland, that area. In that area, we also need nurses. But in general, if you're a registered nurse or an LVN or a therapist, call me and let's talk about your possibilities, your opportunities with Avatar Home Health and Hospice. We've been around 14 years. We're a very solid company. We have never laid off a single nurse or a therapist. If they find a better opportunity and they leave us, fine. But as far as telling them, hey, I don't have enough patients for you, I don't have enough visits for you, that has never happened in 14 years.
That is great to hear.
We have a good census, we stay busy.
Mm-hmm.
So with us, you have a guarantee of getting a good paycheck every 2 weeks.
All right. Well, that does it for this this section, or we should say this segment, I should say. There we go. Felix, once again, we thank you for joining us for Avatar Home Health and Hospice Care. And once again, if you are a registered nurse or you're looking for some extra work, please do call Felix 281-703-8050, and they'll put you to work. And if you're looking for the services, that's the same number to call. Once again, Felix Cannibal, thank you for joining us for this edition of Ask the Experts here on KSEV.
Thank you, Jack. Thank you.
And we thank you, our wonderful listeners, for tuning in. I'm Jack Gonzalez, and this is AM 700 KSEV, the voice of Texas. Have a great afternoon.
Thanks again for tuning in for another Ask the Expert show right here on AM 700 KSEV.